Alright guys, this is a recording for the majority of our week 1 and 2 information for gross anatomy 2. So we're going to go here to our cadaver and we're going to remove the skin. And we're going to start off by just looking at the superficial structures we can see. Ones that are nice and easy to see are going to be our trapezius. Okay, and of course we know that we're going to see 3 parts of the trapezius. We have the upper fibers, we have the middle fibers of the trapezius, and then we're going to see the lower fibers of the trapezius. The cranial nerve that innervates this muscle is going to be our spinal accessory nerve, and it's going to travel with our transverse cervical artery. So we're just going to touch the muscle, we're going to hit the magnifying glass, and then as we do that, we're going to see this window pop up at the top left, and I'm just going to click under the innervation so we can see that first. And so we can see our spinal accessory nerve. Remember, you can also typically find this on top of the levator scapulae muscle. And then we're going to go ahead and click our blood supply. And the major blood supply is going to be the transverse cervical artery. In order to see this, we're going to have to rotate the body, and then we can see that blood vessel right here passing deep. Now, if we wanted to see it better, we could remove all the other structures to reveal that. Okay, we're going to move to our next muscle, which is going to be our latissimus dorsi. Latissimus dorsi, big muscle, lower back. Just going to touch it so that we can see where it's at. Latissimus dorsi is going to be innervated by our thoracodorsal nerve, and of course the thoracodorsal artery is going to be our blood supply. For the sake of time, we're going to do the same thing. I'm going to just highlight our nerve, our thoracodorsal nerve. Remember, that comes off the posterior cord of the brachial plexus. We can then tap the blood supply, and then we can see the same thing. Now, again, you're seeing lots of arteries pop up, but the primary artery that's going to supply this is going to be this guy right through here, which is our thoracodorsal artery. Okay, so we have that right through there. We're going to remove our trapezius, and we're going to remove our latissimus, and we're going to reveal the next layer of back muscles that we need to know. And specifically for gross 2, what we want to make sure we know is our rhomboids minor. Oops, excuse me. We're going to get our rhomboid minor. Remember, anytime we have a minor, just below it, we're going to have a major. And then also at the superior medial border of the scapula, we're going to see this guy here, which is our levator scapulae. And we can even follow it up here to the top where we see it separates out to C1, C2, C3, and C4. We're going to go ahead and search for the dorsal scapular artery here. I'm just going to type it in. Okay, so dorsal scapular. We're going to say that reveals dorsal scapular artery, nerve, and vein. We're just going to go ahead and highlight on the right side the artery. We're going to give it a tag, and then we're also going to do the same thing for the right dorsal scapular nerve so we can see it. Now, as we remove this tissue on the right side, we remove our trapezius, we're going to notice that we still really can't see anything. Okay? You have to look anterior to our rhomboid minor and a rhomboid major to see that. So we're going to zoom in just a little bit. And now we can see that dorsal scapular nerve there. And if we highlight it, we're going to see that it's along the medial border of the scapula, along with that dorsal scapular artery, which is going to be the blood supply we see there. A little bit easier to see if we remove rhomboid minor and major, so we're just going to go ahead and do that. Now we can see the dorsal scapular nerve just a little bit better on top of the serratus posterior, superior, and then of course right through there we can see the artery, but let's highlight it again. Okay. All right, we're going to move over to the arm. The first thing we're going to do is point out our deltoid muscle. Okay, remember your deltoid muscle, you could think of it as sort of your shoulder cap. So we're going to put it back in anatomical position, or the cadaver in anatomical position. We're going to remove our tag there because we don't need that right now. And then we're just going to highlight the deltoid muscle. Now don't forget, the deltoid muscle technically has an anterior, a middle, and a posterior head. So if we wanted to, we can just go through here. We can put pins in each portion of it so we can see where it's at. So we have the anterior head of the deltoid. We can turn the cadaver. We have our medial or our lateral, or excuse me, our middle or lateral. And then we have our posterior head of the deltoid. Now the deltoid muscle we've seen is innervated by our axillary nerve. And if we wanted to, we could turn up the detail and we could see the terminal branch of the axillary nerve popping through the deltoid muscle. Okay. This nerve that we're seeing right here on the deltoid muscle, this would be our superior lateral brachiocutaneous nerve, and we're going to leave these nerves up, and I'm going to remove the pins, and then we're going to remove the deltoid muscle as well. When we do that, essentially what we're going to do is reveal our quadrangular space. We want to be able to locate the quadrangular space here because that's going to allow us to easily identify the axillary nerve here, okay? Now don't forget the axillary nerve is passing right through here with our posterior circumflex humeral artery through the quadrangular space. Now we're going to quickly go through the muscles of this area so that we can see those as well. So we've got our suprascapular nerve above the spine of the scapula. We've got our infrascapular nerve, muscle below the spine of the scapula, so supraspinatus, infraspinatus, and then we have our teres minor. Now, the teres minor, we're going to put a little color on it. We're then going to see that there's a major over a minor, just like what we saw earlier. So here's our teres major. And again, we're going to go ahead and color code these so that we can maybe visualize the quadrangular space just a little bit easier. We then have the long head of the tricep right here, and the way we can tell it's the long head is that it's going to go to the scapula. The lateral head is going to go to the humerus. Now, unfortunately, if we tag this here, we're going to see it highlights both aspects of that triceps muscle. So we really just have to know that this is the long head of the tricep and that this is the lateral head of the tricep. Now, the lateral head of the tricep in this situation looks like it's making up our lateral border of the quadrangular space, but typically that's referred to as the surgical neck of the humerus, creating that. Now don't forget, in this one area, we're not only going to see in that quadrangular space our axillary nerve, we're also going to see our posterior circumflex humeral artery. Okay, so both of those are going to pass through that same area of the quadrangular space. Now, taking a step back, we're going to come back here and we're going to look at the supraspinatus. We're going to turn the body down just a little bit. And my main goal here is going to be to remove the supraspinatus and infraspinatus so that we can see where the suprascapular nerve is going to pass, innervating both supraspinatus and then also the infraspinatus. So it's easy to see underneath the spine of the scapula from this position because it's going to wrap around the spine of the scapula. And we can now see the suprascapular artery and we can see the suprascapular nerve. Okay? We can see both of those there pretty easily. But remember, you do find that in the suprascapular fossa. I'm going to turn this down just a little bit. And when I do that, I'm also going to be revealing the suprascapular notch, okay? So we're revealing the suprascapular notch here in this space, and then we're also seeing our ligament right through there. Now that's our transverse scapular ligament, okay? You don't need to put superior, we can just put transverse scapular ligament. Remember, we're going to see the artery and the nerve relative to that area. We're then going to see our teres minor, which we've already pointed out, and then also our teres major. Now, when we're looking at the tricep muscle, we can also see that there's another nerve popping out between the two heads of the triceps muscle. That nerve is going to be on the back side here of the biceps, or excuse me, of the brachium. So we've got this guy here, and what we want to do is we want to follow it. Where does it go? Where it goes ultimately is to the lateral side. So with cutaneous nerves, step number one is going to be is the nerve on top of a muscle. If it's on top of a muscle, we know it's cutaneous. And then number two, what we're going to do is we're going to follow the road all the way to where it stops and then maybe touch it on ourselves. We can see this stopping right here at the brachialis muscle. Okay, let's give this a color so it sticks out. And we can see that it stops by the brachialis. Now the brachialis is on the lateral aspect of the arm, so this is going to be the inferior lateral brachiocutaneous nerve over the lateral head of the tricep going towards the brachialis. Now if we look close to it, we're going to see that there's another nerve. Okay, I have another nerve coming off the radial nerve, which will be deep to these structures, and it's going to go all the way down to the forearm. Remember, what we want to do is we want to see where does the nerve stop. And what we see is that that nerve is actually going to go all the way down to the forearm. Let's just zoom out a little bit. And we can see that that nerve goes all the way down to the forearm. Now it's on the back side of the forearm, so that means that that nerve is going to be the posterior antebrachiocutaneous nerve. And again, that's going to be a branch from the radial nerve. So let's turn the body back around in anatomical position. We're going to zoom back in. And what I want to see now is I want to see the actual radial nerve itself. Okay. Let's see the radial nerve itself. So far what you've seen here are the cutaneous branches of the radial nerve. What I want to do is I want to remove the triceps. And what we're going to see is our triangular interval. Now, unfortunately, in order to reveal these structures, I really had to get rid of the triceps muscles. And that's kind of unfortunate because that does make up a portion of the triangular interval's borders. So what we're going to do is we're going to look at our highlighted yellow nerve, which was inferior lateral brachiocutaneous, and our green nerve, our posterior antebrachiocutaneous, and we can see that they both come off this major nerve right through there. So this has got to be our radial nerve. Remember, the radial nerve is going to come off of the posterior cord of our brachial plexus. It's going to wrap around the backside of the humerus, and then it's going to pop out on the lateral aspect of the humerus. Okay, so it's very challenging for me to tag apparently. Okay, we have a radial nerve, and I am going to color code it for us just to try to make it pop a little bit more. And we see that the radial nerve travels with the profundi brachial artery. Okay, so again, those two both pass through the triangular interval. Now we're going to move back to the anterior portion of the body, and I'm going to maybe get rid of some of the details here of the nervous system, just so things aren't so cloudy. We've removed the deltoid muscle here on the right side, okay? We don't really need the breast tissue right now either, so we'll get rid of that as well. So we'll leave that, okay, through there. Okay, so what we can see right through here is the pectoralis major muscle. Okay, so again, pec major, technically divided into a clavicular head and a sternal head, innervated by our medial and lateral pectoral nerve. I'm also going to point out that on this other side, we can see the deltopectoral groove, and inside that groove is going to be your cephalic vein. Remember, on the medial side of the arm, that's where we're going to find our basilic vein, on the medial side all the way down the arm. Now, if we remove the pectoralis major, we're then going to be revealing our pectoralis minor. So underneath, going from coracoid process typically to ribs 2 through 5, we have the pectoralis minor, which is innervated by the medial pectoral nerve only. Beside this area, we're also going to see our serratus anterior. And we're going to go ahead and throw these nerves back on, because when we do that, we're going to reveal our long thoracic nerve. We're also going to reveal our our thoracodorsal nerve. Now, one of the reasons why we want to see these two kind of close together is because they're kind of close together in the axillary region. So right on top of the serratus anterior, and let's just give that a little bit of color. That'll make it easier for us to see. Right on top of there, we're going to be able to see our long thoracic nerve coming from the brachial plexus roots of C5, C6, and C7. And then the artery traveling with that is going to be the lateral thoracic artery. Now, close to it, over here in the axillary region, there's another nerve right beside it. And we want to be careful with that. It's a little more lateral because this nerve is going to go to your latissimus dorsi. That's going to be our thoracodorsal nerve. And remember, your thoracodorsal nerve is going to be traveling with our thoracodorsal artery. And those guys are both going to be supplying the latissimus dorsi. Okay, thoracodorsal artery is coming off the subscapular artery as it divides and gives us scapula circumflex and then thoracodorsal. Now, as we continue looking in this area, we have our biceps muscle. Okay, just to point out, we do have our subclavius muscle up here underneath the clavicle. Hopefully we can all identify that one. We have here these two heads of the biceps. Now, I'm going to give this a little bit of color. Okay, we'll let the biceps have just a little bit of color to make it easier to see the structures. We can see passing through the bicipital groove the long head of the biceps muscle. We can see going to the coracoid process over here, the short head of the bicep. So remember, if you have it tagged specifically up here where the tendon is, you would technically want to say that's the tendon of the short head of the bicep. Here we would say that this is the tendon of the long head of the bicep. And then if it were down here in the muscle belly itself, okay, let's scroll down just a little bit. In the muscle belly itself, we could just say biceps muscle. Now, over the top, we can see that there's a nerve there. Okay, that nerve that we're going to see right through there, right? It's going to be our medial antebrachial cutaneous nerve. Now, we want to be careful here because this nerve is tagged possibly in the brachium. So how do you know it's the medial antebrachial cutaneous nerve? Remember what I said earlier, you want to follow it all the way down until it stops. We name this according to where it stops, okay? So again, even if it's tagged here and some of the branches do stop here, we want to continue following this the rest of the way, and that's how we can see that this is appropriately named the medial antebrachial cutaneous nerve and not medial brachial cutaneous nerve. Now, another thing about the medial brachial cutaneous nerve is that it's also really short, okay? The medial brachial cutaneous nerve, because it's a little bit shorter, is not going to go as far down the arm, okay? So it's going to stop around the brachium. You can see right through here, our medial brachial cutaneous nerve coming off the medial cord of the brachial plexus. We'll give it a little bit of color to try to make it pop a little more. So be careful. Remember, on test day, trace out the nerves and see where they go. If you see it stopping right here in the brachium, then it's got to be medial brachial cutaneous. If it goes all the way down to the forearm, we know it's medial antebrachial cutaneous. Now, for a second, we're just going to go ahead and remove our nerves and our cardiovascular tissue, just to make things nice and clear. We're going to remove the biceps muscle, and deep to the biceps muscle, what we're going to find are two other muscles. One is going from your coracoid process over to the brachium. This is our coracobrachialis muscle. Inferior to that, we're going to find that there's another muscle that's right underneath the biceps muscle, known as the brachialis muscle. Now, we're going to go back and we're going to add in just the musculocutaneous nerve. So we're going to go to brachial plexus, go down to maybe just the musculocutaneous nerve. Okay. Now the reason why I want to just bring in the musculocutaneous nerve is because I want you to see it piercing the coracobrachialis. See this guy here? The musculocutaneous nerve is going to pierce the coracobrachialis, so that lets me know that's coracobrachialis, but it also lets me know that's the musculocutaneous nerve. We then are going to see the brachialis. Now remember, the musculocutaneous is sandwiched underneath the biceps and the brachialis. Ultimately, that musculocutaneous nerve we said is going to emerge. We said it was going to emerge out from under the biceps and the brachialis, and we said it was going to become the lateral antebrachial cutaneous nerve. So if we look right here, we can see it continuing all the way down into the forearm. Now it continues all the way down into the forearm once we add everything back on. That is our lateral antebrachial cutaneous nerve. Remember, when it's underneath the biceps muscle, we're going to call that the musculocutaneous nerve. After it pops out, it's just the lateral antebrachial cutaneous nerve. Okay. Now, there's a few structures that we want to see from the axillary artery. And sometimes one of the best ways to see some of these things is just to go in and try to build it by itself. So we're going to start off here with the axillary artery. Now remember, our axillary artery is going to begin at the border of the first rib. So let's go ahead and let's add in the ribs, because the ribs are a great landmark for where the artery begins. We said from the lateral border of the first rib until we get to teres major, we have the axillary artery. So we're going to add the teres major in here too, so we can see the entire length of it. And now we're going to add off just the branches that we get from the axillary artery. So the first one, if you remember, is going to be our superior thoracic artery. So the very first branch we get through there, that's our superior thoracic artery. We're going to zoom in a little bit because we just really need one side to see it. It's symmetrical on both sides. Okay, so we've got our superior thoracic artery right here. Okay, we'll give it a little bit of color so it pops. We then come to the second part of the axillary artery, and that's when we get two different portions. We're going to see, first off, the lateral thoracic artery. So let's just see that. And we said the lateral thoracic artery would be on the rib cage because it's going to go to the serratus anterior. We are also going to see the thoraco or the thoracoacromial trunk. So we're going to add it in. and then we're going to add in all the branches. Remember, there's 4 branches that come off the thoracoacromial trunk, so we're going to add in each one of those branches. Okay. Now remember, the trunk is going to be the origin. So if we look right through here, we can see that there's this part that comes directly off the axillary artery, and that's going to be our thoracoacromial trunk. Okay. Here's our thoracoacromial trunk. Now you could also call that the thoracoacromial artery, and that's okay if you want to do that. And now we're just going to follow the road. If this is pointing to where the clavicle would be, this will be our clavicular branch of the thoracoacromial artery or trunk. If it's going from here to where the pectoralis would be, we're going to call that the pectoral branch of the thoracoacromial trunk. And we'll go ahead and we'll give it some colors. We'll color code it. So there's our pectoral branch. Here's our clavicular branch. This is going to be our acromial branch because, of course, the scapula would be up in that direction. And we could add the scapula in just a second so we can see it. And then, of course, we would have the deltoid branch pointing laterally on the arm. And those are our 4 branches, okay? Now, those are the 2 arteries that come off the second part of our axillary artery. Okay, we'll give this some color too. Now, the last part there, and let's go ahead and let's add in the scapula. I guess really we could add in the entire skeleton just to make it easy, but we can see the scapula, and of course here we can see this is going up to the acromion. We can see this is going to where the deltoid would be. Now the last part, I think I will just go ahead and add in the rest of the skeleton here, is going to be the anterior and posterior circumflexohumeral artery. Okay, so we're just going to search that up. And so we can see coming off the axillary artery, just at the last part, there's our our anterior circumflexohumeral. And then of course going posterior is going to be the posterior circumflexohumeral artery. Now there is one more artery that comes directly off the axillary, and that's going to be our subscapular artery. So let's just look for that. Subscapular artery. Okay, so we've got the subscapular artery, and you'll notice it's just a little bitty stub. See that stub right through there? That's our subscapular artery. Okay. We'll give it a different color to make it pop just a little more. Now from the subscapular artery, we're going to see that give us our scapula circumflex and the thoracodorsal artery. Let's just add in thoracodorsal and search up the scapular circumflex artery. We don't see anything, and so let's go just circumflex. That might be how it's written, circumflex scapular, and there it goes. Okay, let's add that on. Now the scapular circumflex artery should be easy for you to identify because it's going to circle around the scapula, and it's going to end up in that triangular space at the back of the arm. See that guy right through there? Scapula circumflex. And of course the thoracodorsal artery we already mentioned was going to be a little lateral and going to the latissimus dorsi. Now I believe that is all of the structures that are on our week 1 structure list. If we wanted to, we could go back and we could add in on the muscles. We can see some of these blood vessels here, our pectoral. We can see our lateral thoracic artery, and you can see your thoracodorsal artery all down through here. So there's part of the pectoral going through the pec. You can see lateral. You can see this guy here, that's thoracodorsal. And then if we wanted to, we could just remove the pec and see what we can see of the axillary artery if we remove the deltoid there. And now we can see these maybe a little bit better as they're passing through there. And those are all the branches of the axillary artery.